It will now be compulsory for each household to make a contribution of 500 shillings to the National Health Insurance Fund in new reforms as the government rolls out a health cover for all Kenyans. So in a bill by Majority Leader Amos Kimunya, employers will be required to make an equal contribution to the fund for their employees as the government moves towards attaining universal health coverage. And as Stephen Letoo now reports, MPs have approved heavy penalties for employers who fail to remit the fund or deduct the same from the employees' salaries.
As President Uhuru Kenyatta's term draws to a close, MPs raced against time on Tuesday to streamline the much-hyped universal health care. Through the NHIF Amendment Bill 2021, the lawmakers in tailored amendments made it mandatory for all adults to be contributors to the National Health Insurance Fund. The bill reads in part, contribution will be by all Kenyans from 18 years and above in both formal and informal sector. Employers are required to contribute an amount equal to that which they have remitted on behalf of their employees. The bill pegs a compulsory contribution of 6,000 shillings for the self-employed with no option of voluntary contributions to the fund.
Contribution under subsection 2A and B shall be at such rate depending on the person's total income as the board in consultation with the cabinet secretary may determine.
For us to motivate the people who are not employed, the people who are hustlers, wherever they are, Mr. Speaker, it is important that we must give it a human face.
Because it's a compulsory fund and you want to accommodate all the different people, those who are employed, those who are self-employed, but with a family or without a family, and those who are unemployed, whether youth or older persons.
The bill proposes to have employers whose employees are liable as contributors to the fund to also be contributors to the fund. Employers shall make a matching contribution equal to that made by their employees according to the new changes.
Will as many as of that opinion say aye? Aye. Many as of a contrary opinion say nay?
Nay. What the amendment of Kimani Ichung'wah is bringing is the designation of by the chair and the CEO. So you don't require a resolution of the board to have someone authenticate.
The reforms seek to safeguard employees from having to pay double subscriptions. An employer is expected to make a matching contribution to that of their employee and is not allowed to deduct the same from the employee's salary or benefits.
We are also including national government entities, which includes parastatals and any other semi-autonomous government agency.
This, Honourable Speaker, is to exempt a natural person, Honourable Speaker, from paying penalties.
We have not defined the contribution by a natural person.
The leader of majority, really, maybe because I didn't explain, and of course he never went to the Alliance High School, he may not have gotten it.
A majority leader is a holder of a PhD. He understands what a natural person is. I am a doctor, I'm a surgeon, consultant surgeon. I understand what a natural person is. I don't need to have gone to Alliance to understand. No. That Alliance part.
The bill proposes to introduce empaneled healthcare providers with the criteria for the empanelment and contracting of healthcare providers set by Health Cabinet Secretary and the National Hospital Insurance Fund Management Board. The proposed changes have been challenged by various stakeholders, with the employer's umbrella body FKE as well as the Central Organization of Trade Union saying the proposed piece of legislation did not factor in the unemployment statistics in the country, with majority of those aged above 18 years still jobless. Stephen Letoo, Citizen TV.